Would you like a second opinion on your diagnosis? Please send your analysis and medical history to Visite at qs24.tv, and our Chief of Medicine, Miss Dr. Wiechel, will analyse them for free and anonymous in our new series Visite. For more information, visit qs24.tv. Hello and welcome again to our series Visite. I'm very happy that you are back, and above all, thank you very much for the many letters. I have again chosen a few of them, which I will present today. And I would like to start right away with a letter of an 87-year-old patient who reported that she got breast cancer over and over again, and the last time was a few years ago, and now she's already 87. Thank you very much for this letter. Her question was, I kept getting breast cancer after I went through major psychological events, and in the context of a severe stressful situation, it have every time been linked to a new diagnosis of breast cancer. She then asked her family doctor whether there were any connections there, and he said no, or there were none. There is no causal relationship. That has not been proven. I have to contradict that because we always have to take into account our psychological level. The body is always dependent on signals in its self-coordination and self-regulation, and psychological stress that goes so far that there is, for example, conflict or death of a child and many other things that trigger something. So with our body chemistry, we're always the result of our life. An example: a family with 2 sons and a daughter experienced, in the first year, the older son's testicular tumour disease. A year or 2 later, the middle son has a testicular tumour. And 2 years later, the father has a testicular tumour. And there too, the clear answer was given: it has nothing to do with psychological stress at all. But at the moment, there is no genetic disposition here. There is only the fact that this is a very happy family, but there must have been something that this family went through together. And there was. In 2010, the grandparents, so the father's mother and father, the grandparents of these 2 sons died in a plane crash. The fact of what happens in a shocking experience was already demonstrated by Ryke Hamer years ago, and he just did not find access to medicine that all this knowledge is established today. There has been quite a position of power on both sides. But what he left us as legacy was the fact that he told us how such conditions get, how should I say, expressed by the autonomic nervous system precisely, to this conflicted point. And he showed why we get breast cancer on the right side, why we get it on the left side. He has shown that it is important to know if the woman is right or left-handed. Is it a partner? Is it a mother-child conflict? That is knowledge that's not taught. But today there's only by observation And when a patient comes to me with a tumour disease, then I always look, what did Hamer say back then? What things do I have to look for? What do I need to know? What did this person go through? And what has changed in them too? We already talked about the problem of a tumour disease in this Visite series, but especially with breast cancer and with this elderly lady for whom I now don't know further how it was treated and so on, it certainly provoked a change in her too. This is not just the experience of fate that she went through, the stress that she experienced, it is the adaptation of the body that was forced now to exhaust itself as part of a stressful period. And we know the connection between a lack of adrenaline and the development of tumours. We know the connection between stress and an exacerbation of a viral disease. Just think that often people get shingles who were shocked, overwhelmed, or in a car accident. There was now a patient with me with severe herpes on her face. She had lost her cat 6 weeks ago. This may not be the problem for everyone, but it was a big problem for the patient because the cat was part of the family. And it got run over by a car in front of her eyes. And she had had such a deep love and an intimate relationship with this little animal for almost 19 to 20 years. That wasn't enough. 2 weeks later, her husband collapses in front of her in a restaurant and falls to the ground. So this loss conflict, the second time the most important person in my life by my side leaves me, triggered the signal for the immune capacity to be manoeuvred downwards in shock. So in that moment, everything can exacerbate. Every virus can reactivate. Every shock can make a change. And this woman then got herpes on her face. And the family doctor said, no, it has no connection whatsoever. I'm sorry, but it has an immensely big connection. And your ability, your individual ability to tolerate something, to compensate for something, to accept something, is always greater when you have peace within yourself. You get stressed, the body also has to direct energies. If it directs the energy as part of an escape and fight situation into stress, it can't fulfill regeneration tasks. Then it can't ensure a hormonal balance. Then it may not be able to produce enough melatonin to make you sleep well. This is always at the expense of its health and its regenerative capacity. And that's why it's really quite admirable, because the older lady has certainly always bravely manoeuvred herself out of this difficult life situation. That has something to do with the fact that some people with a tumour diagnosis experience a terrible state of shock, and this sword of Damocles hangs over them, and this vision that they might not survive this tumour disease weighs so heavily that, of course, in the subconscious, a constant fear spreads, and it's a very big and incredibly personal attitude to remain calm in the context of this illness. People I experience who live and survive incredibly long with the most serious illnesses are all those that surrender completely with the diagnosis and with the path they have to go now. Surrender everything and not lift themselves above something divine that they decide how long they live, but now focus on what they need. Because only in the context of an inner balance, in the context of an inner preparation, you have an immune capacity that can be measured up to Mount Everest. For example, if you stand in the rain when you're in love, you can stand in the rain all night, nothing will happen to you. But let's imagine a different situation. You got cold and forgot your coat and are soaked. You're also completely stressed and overtired. Then your body will ensure that you have to rest now. And you're going to have a really nice flu virus because the viruses are reactivated by this process. And understanding that is, of course, a very, very valuable line of sight also in a tumour disease, which this elderly lady described here. And I can really only stress that your intuition was right. And sometimes it is also these real life fates that we have to go through in order to emerge stronger from this process. And 85 or 87 years old, I think that's really, really great. And I wish you from the bottom of my heart a completely fulfilled life and a nice time in this earthly existence. That was the question of this patient who had breast cancer for the 5th time. And maybe I can spend time on another smaller question. Someone asked to explain why we always have to sneeze so hard. And sneezing can also be a sub-allergic problem. Sneezing can be a problem that the body asks for relief. Just as it does when you keep having increased mucus here and have to cough up again and again. These are processes that it doesn't do arbitrarily and doesn't even need, but which it needs for a process that burdens it. And while we talked about mucus, membranes, and the nose before, I have to tell you we actually have to take better care of our mucous membranes as humans, because mucous membranes, regardless of whether it's the eyes, whether it's the nose, it's the mouth or the throat, the esophagus, the intestines, the bronchi, the bladder, these are all valuable immune barriers that give us the first contact with the outside world. But of course they also have to take care that a stranger, an intruder, recognised by the immune system, to then also accordingly ask for a certain presence in the body and to stay there. If the body is not able to absorb this foreign allergen, for example in the case of an allergy, if it realises it doesn't recognise it and it can't involuntarily let it pass now, then it may create a problem. Then it has already developed enough mechanisms to fend it off. Then that's the overreaction. For example, if you're allergic to birch pollen in spring, you have a terrible sneeze. And this sneeze is nothing else but that when the body comes into contact with these mucosal pollen, it wants to get rid of this contact. Achoo. But it is exactly the same that through this inflammatory reaction and through this strong tear flow, it wants to wash it out of the eyes. These are also contact surfaces, the conjunctiva of the eyes, and you can actually measure this immune capacity of the mucous membrane very nicely. This is the so-called secretory IgA. That is a value that you can take from the blood. You can also do that as part of the stool examination from the stool sample. But the integrity or strength of this secretory IgA shows the mucosal enzyme system of the mucous membrane. This is what you need to regenerate again. And a strong sneeze always has something in the background that the body wants to fight off something that burdens it, what you may not even know yet. I used to work a lot with the Imhauser autologous blood therapy because a patient came who had an unexplained allergy. He'd eaten something and suddenly it started and everything was swollen and he had shortness of breath. That was very scary, and he was already under permanent cortisone. And actually no allergen was found. So that the patient didn't even know what to do nutritionally and so on. And then I still know that I used to treat this patient repeatedly with injections of autologous blood, and later he only took the drops of autologous blood. So you shake these drops several times and then it comes to different potencies, and only this autologous blood has always presented the information to the body when it wasn't available in bulk, but the blood stored the information. And it was so nice to see how this patient no longer needed anything from month to month, from year to year. And nothing at all happened anymore. What was coming again at the beginning with the tongue, and now it always started, it ebbed away always very quickly. And I have also experienced this very, very often with children, especially asthmatic children, who could never go to other children's birthday parties when there were horses with their horsehair allergy. No, it's never the allergen. It's always due to the excessive overreactions of my immune system. And in the context of this situation now, when you say, what if I have to sneeze all the time? You have to look very closely at the mucous membrane situation, of course. But no therapy goes there without first knowing what is going on in the bowel. It may as well be the gut reaction. Maybe you are allergic to egg white and you don't know. You eat it, you don't know. All is well, you don't know. But 3 days later, these sneezing attacks are back. Or you get asthmatic pressure because you may actually be avoiding milk. But there was condensed milk and, well, you had no other lactose-free milk or whatever. You came into contact with milk, so also unconsciously, and have an asthma attack 3 days later. You have to take care of it, and often it is not about an immediately allergic reaction, but we are talking about IgG-mediated remote reactions. So we are talking about the inflammation that occurs that can also provoke multiple problems. And that is the sneezing, and a runny nose also means getting rid of something through the nasal mucous membrane. For example, Ryke Hamer developed what is known as homotoxicology. And he has developed 6 phases. The first phase, for example, the excretion phase. So now I'm going to a party and had a stressful day. Had to buy an emergency present quickly. And in the evening, there is the big party. I'm starved and eat the buffet up and down. And in the night, it starts with an insane vomiting. And above all, diarrhea. That doesn't have to be blamed on the salmonella potato salad. That was just the day was so stressful that the digestive power was not available at all. And the body helps itself. That is, it's self-help first to create relief, up and down. You would do well if you don't block the relief path with Imodium now. The same is if, for example, it's Saturday and I bought the present 4 weeks ago and everything is ready and my hairdresser appointment is on time. I don't need to work. I take a nap in the afternoon. I'm also hungry because I skipped lunch. But I enjoy the buffet and I eat way too much, but I'm good. you can see that this excretion phase is not needed at all. And then when the body can't get rid of something, because you stop the diarrhea quickly or whatever, it is not yet finished with this process. It moves on to the inflammatory phase. So if toxins stay in the body, it can only go via inflammation. These are the uric acid crystals, for example, or rheumatic processes at the connective tissue level that are inflamed again and again. And then the third phase is a phase when something just becomes manifest. And this manifestation phase means now there is a lump. Now the osteoarthritis begins. Now something begins that it is now somehow fixing in a persistent manner on this level. And then we have the big biological cut. And after the biological cut, other phases arise. And then disease also arises at the cellular level. And these are very important processes that you have to understand, because under the aspect that makes our body does not make mistakes, we have to accept that it needs this relief now. That it needs this sneeze now. That it needs this cough now. That it needs this diarrhea now. That is now sweating profusely at night. That is always a sign that it's trying to relieve externally. And in my opinion, we can't block such processes in advance if we don't analyse what is behind them. It's wonderful that there are so many drugs that we can take to make a process less painful. It's great that we know there's a painkiller when it's bad. But while you are satisfied with a painkiller for weeks, months, the dentist will not help you to really find the focus, to relieve you there. And that's especially a big question in the area of the mucous membranes, of course, especially in women who slowly go into menopause. The health of the mucous membranes is hormone dependent for all of us, including men. So these are all questions that you have to face, and also please pursue such things. If you suffer from symptoms that are always present, they might actually be only a little cry for help of the body. Please help me with my allergy. And then, in my opinion, it doesn't really help to have a desensitization with all the safety precautions that people then don't leave the practice for 2 hours. They can certainly reduce the symptoms against this allergen for the next few years, but the reason for the allergy is not clarified. And I already have my justified worries and needs to see how sometimes an allergy becomes another allergy or another one, or food allergies that arise. There are parasites behind them. And if you don't recognise the parasites, you won't be able to treat a food allergy either. So this instant allergy, with almonds, I immediately get a swelling throat or become red, or after a completely different foods, or also plants or whatever, strawberries. Make sure you really pay attention and find a colleague who is very familiar with these things too. And please get to the bottom of these things. We just have to really lose our medical superficiality. We also have to lose the fact that everything is so terribly easy to treat. We have to see the seriousness of these things, and we have to treat them from the root. If we don't do that, then we will again and again help the body into an unkindness, and the burden that our body has to bear today is many times higher, many times heavier, and also much more dramatic. Because what I can observe is that diseases are increasingly moving forward from age. Or you can overlook the fact that we already have children with first signs of osteoporosis. We can't say that we can get that under control with a bit of calcium, or that children have juvenile rheumatoid arthritis, we call it, when 6-year-old children already have rheumatism. We can't do that, just give these kids cortisone or anti-rheumatic drugs. There are causes behind this, and if a doctor has limits, and every doctor is entitled to them, we too have our limits, but then we have to find ways, then we have to find colleagues, and then we have to unite to a common ground, because we all need each other. We need the diagnostician, we need the emergency doctor, we need the cardiologist, but we need, and that is the most important thing, we always need to look at the whole person. And that is why every diagnosis for me is always the name of the patient, because I don't care whether you say MS or Parkinson's or tumour. It is a disease that was able to develop in this person, and we can't lead them out of it. If we don't at the latest then, and it is my wish that we use completely different medical examinations as the basis, that we can recommend all of these things to you beforehand, what it needs from you, because you alone decide what you buy, how you live, whether you stay with a man who drinks and pulls yourself and your family into the ground. You decide if you want to live this way or if you want to live that way. And a lot happens unconsciously. And that is by no means an accusation. I don't want to be misunderstood, but a lot is created consciously, and you decide whether you leave your cell phone on at night or whether you switch off Wi-Fi at night. These are fire accelerators for today's diseases. And all this responsibility, I would like to know it to be in the hands of the patient, because you can choose what you want. But as a doctor, I also feel an immense responsibility for you, because you confide in me. So I have to find a way with you how you can get over this disease and lead your body as best as you can out of this disease, because you also led it into this disease. And it's too easy to believe that everything is just genetic or idiopathic. Everything has its causes, and we can already recognise and know a lot today. It just takes the will and the depth and the time. And the focus on these things. But then you can achieve an incredible amount. And I can't get involved at all in things that are called chronic. Who says that? Chronic is only said by someone who has no plan to understand this disease. And if I don't understand how illnesses arise, then I will only try to maintain it at the top level. And I think this has to stop. And that must finally be a concern of us doctors, so that we can protect you from what you might run into a little unconsciously and would like to change beforehand. With this in mind, thank you very much for your patience, and above all for your attention. And I'm really looking forward to next Sunday. Goodbye. Dear viewers, the preceding episode is an indicator for a holistic medical approach and does not replace visiting your family doctor. Thank you.